Welcome to Crowd Europe. Healthcare for foreigners in Portugal. Portugal's public health system. If you're looking to move to Portugal or to spend extended periods of time in the country, it's important to know about healthcare for foreigners in Portugal. Portugal has universal health coverage through its publicly financed national health service called the Serviço Nacional de Saúde (SNS). Basic national health coverage is administered through local and regional health centers and through hospitals and includes all care other than dentistry. This service is available to all residents of Portugal. Healthcare under Portugal's national health system is free for children under 18 and for people over 65. Otherwise, unless it is urgent care or falls under specific circumstances, healthcare is available under the NHS at a low rate. Medication administered during a hospital procedure by the hospital is free. How good is Portuguese healthcare? If you need healthcare in Portugal, you can visit your nearest health center for medical assistance. If the situation is an emergency, you can go to the emergency room at the nearest hospital. If you require assistance, you can phone the European emergency number, 112. You can also call the SNS information hotline, 808,242,424, which is available 24 hours a day, 7 days a week. The service is available in English and is free of charge. Portugal's private healthcare options. Private doctors and facilities are also widely available. Public-private partnerships for new hospitals, changing hospital management structures, pharmaceutical reforms, reorganization of primary care and the creation of long-term care networks have improved the healthcare system in recent years. Virtually all doctors in the public and private systems speak English. Are you entitled to Portuguese healthcare? The Portuguese health service is very similar to that of other countries, such as the UK, providing hospital and local health centre services. Visitors will find that healthcare for foreigners in Portugal is much the same as it is for residents. The main difference between the Portuguese system and others is that everyone who uses it must pay a small charge for consults and tests. Emergency care is free, as is health care in several other vital situations, without coverage through reciprocity, NHS, or private healthcare. All other services are charged at full price and are sometimes payable at the point of access. Everyone will receive hospital care if necessary, although you will be charged if not covered by the Portuguese National Health Service, a reciprocal agreement or private insurance. Healthcare for short-term residents and visitors to Portugal. Short-stay visitors with a Schengen visa must have a minimum health insurance coverage of €37,000 to enter Portugal. Those applying for temporary visas are required by law to have health insurance, which can be obtained in their current country of residence. Non-EU students must also prove they are fully covered by health insurance. If they don't, the Portuguese government will not approve their visa and many schools will not accept their enrollment. Healthcare for short-term working residents of Portugal. Working residents of Portugal contribute to social security and can, therefore, obtain a número de utente and will be assigned a GP. If you are not yet a permanent resident but have been resident in Portugal for at least 90 days, you can obtain a document stating this from the local Junta de Freguesia and use this document, a photo ID, their IRS number and a proof of address to obtain a número de utente, which will allow them to access Portuguese health services at a discount. Government-funded subsystems cover public employees. There are also private subsystems which are similar to the employee-provided health insurance elsewhere, for employees of specific types of companies, such as banks and larger corporations. This type of cover is not the norm, however, and most who have private insurance pay for it themselves. Healthcare for non-habitual residents. Tax residents in Portugal. Many people are currently taking advantage of the non-habitual tax regime in Portugal. The scheme was launched in order to encourage investors and professionals of high cultural and economic worth to move to Portugal. First implemented in 2009, there are now over 10,000 NHR residents in Portugal. Those who qualify for the regime can benefit from significant tax reductions, or in some cases can be entirely exempt. The type of healthcare for those living in Portugal as non-habitual residents depends entirely on specific circumstances. Professionals who are contributing to the social security system will be able to use the Portuguese health service, whereas those who are not may wish to invest in private healthcare. Take a look at our complete guide to the non-habitual resident tax regime for more information. Healthcare for foreigners in Portugal, EU citizens. Visiting EU citizens are covered by Portugal's NHS through reciprocal agreements. When traveling to Portugal, they should bring their EHIC card with them and present it to any hospital or doctor to guarantee government-funded care. There are also many private health clinics all over Portugal, which are relatively inexpensive. You can expect to pay around €40 for an appointment with a general practitioner. Healthcare for foreigners in Portugal, long-term residents. Those living and working in Portugal who are not covered by reciprocal agreements with their home countries have two options. You can either pay into the social security system, which is incremental in relation to income, or opt for a private healthcare plan. Is there a language barrier within healthcare for foreigners in Portugal? Portugal has a history of dealing positively with immigrants in terms of healthcare, and many medical professionals are sensitive to language barriers. Additionally, virtually all doctors in the public and private systems speak English. Thanks for watching. If you like video, then share and subscribe channel. Crowd Europe.